Historically, in terms of our development, even during the pre-colonial times, there was a division where we had more development in the southern part of Ghana than in the northern part of Ghana. In certain parts of Ghana, we have high poverty rates, sometimes as high as 70% and as high as 80%. We also have stunting and malnutrition amongst children, particularly below the age of 2 years.
Malnutrition is such a huge contributor to the overall well-being of the child. We often say that about 40% of all cases of disease can be linked somewhere to malnutrition. Your immune system is compromised. Children don't recover from diseases as quickly as they could recover from diseases. And we're learning from research that, after 2 or 3 years, the effects of chronic malnutrition are actually permanent.
The government of Ghana, under the Ministry of Local Government and ILO, conducted a research. They realized that we had gaps. So there was no social protection program being funded by government for children under 5 years. We realized that women, pregnant women, could be targeted, and then that would address stunting and malnutrition. So that is a gap that LEAP 1000 is filling.
So the LEAP 1000 program is an expansion of the LEAP program, which is a cash transfer scheme that tried to target the poorest households in Ghana. The main difference is this expansion is now targeting a new category of people, which are the pregnant women and families with children below 1 year of age. In addition, the LEAP 1000 is expected to have impacts in terms of malnutrition and particularly in relation to stunting. There have been a lot of investments in poverty reduction interventions. None of these interventions has a rigorous impact evaluation. It's important for a country to know if their investments it's worthwhile, if it's having results in terms of poverty reduction, it's helping poor to be more self-sufficient. Having an evaluation for poverty reduction interventions, it's one of the most important innovation that the cash transfer programs brought to the development sector. The LEAP 1000 program and the evaluation that is being tailored to this program also provide evidence. It's important at the national level, but it's also important at the global level to inform a discourse on the 1,000 days and how cash transfer can improve child's health.
So with one social protection intervention like LEAP 1000, we are able to address so many issues. We are able to improve access to health, we are able to improve access to food, and we are able to ensure the social development of that child in that poor region of Ghana who would otherwise have been stunted and who would otherwise have suffered from malnutrition and therefore would have suffered from access to poor quality education.